Senator Angus King sponsors resolution to support USPSTF after potential disbanding. Imagine a world where proven health screenings and preventive care recommendations suddenly vanish, leaving Americans in the dark about crucial steps to protect their well-being. This is the alarming scenario that two U.S. senators are fighting to prevent. Senators Angus King, I-Maine, and Elizabeth Warren, D. Mass, have introduced a resolution to safeguard the U.S. Preventive Services Task Force, USPSTF, a panel of independent medical experts that has been guiding primary care physicians since 1984. Their move comes in response to reports suggesting that Health Secretary Robert F. Kennedy Jr. might disband the task force, a decision that could have far-reaching consequences for public health. But here's where it gets controversial. While the Department of Health and Human Services insists no final decision has been made, the mere possibility of dismantling this trusted body has sparked widespread concern. The USPSTF's recommendations, rooted in transparent, evidence-based reviews, have been instrumental in shaping preventive care in the U.S. Since the Affordable Care Act of 2010, their guidelines have ensured that essential services, like screenings for heart disease, breast cancer, colorectal cancer, cervical cancer, and lung cancer, are covered by most health insurers without co-pays. They've also championed interventions to combat chronic diseases, such as smoking cessation, obesity management, and blood sugar control for both children and adults. And this is the part most people miss. The USPSTF isn't just about screenings, it's about tailoring health advice to individual needs. As Dr. Carol Mangione, a primary care physician and former USPSTF chair, explains, these recommendations are easily accessible and tailored to someone's age, their background risk, to ensure they achieve the best health possible. Without this task force, Americans could lose access to life-saving guidance, from postpartum depression screenings to statin therapy for high-risk individuals. Senator King, in an interview with NPR, emphasized the broader implications. Prevention is at the heart of how we need to approach the cost of healthcare in this country. To see that process disrupted would be a huge blow to the health of Americans. He fears that without the USPSTF's rigorous, science-backed approach, the system could be flooded with unproven interventions, wasting resources and potentially harming patients. While the resolution itself doesn't carry the force of law, it sends a powerful message. As Dr. Aaron Carroll, CEO of Academy Health, notes, it shows that lawmakers understand how crucial the USPSTF is for keeping health decisions grounded in evidence, not politics. But the question remains, is this enough to protect a vital pillar of preventive care? Or will partisan interests overshadow the health of millions? What do you think? Should the USPSTF be preserved as is, or is there room for reform? Could its disbandment lead to better, more innovative approaches to preventive care, or would it be a step backward? Share your thoughts in the comments. This is a conversation that affects us all. RFK Jr. versus cancer screenings. Politicizing public health? Dr. Liu responds. Imagine a scenario where a routine checkup uncovers a 6-centimeter mass, a discovery that, while terrifying, ultimately becomes a lifeline for a patient. This was the case for one of my patients, who, without any health concerns, underwent a checkup that led to the detection of lung cancer. Thanks to the U.S. Preventive Services Task Force's guidelines, her doctor ordered a scan, and she was promptly referred to our hospital for chemotherapy and immunotherapy. Had it not been for these guidelines, her cancer might have progressed to an incurable stage before being detected. For over 4 decades, the task force has been instrumental in saving countless lives by catching infections early and detecting cancers in their early stages. However, recent reports suggest that Health and Human Services Secretary Robert F. Kennedy Jr. is contemplating a move that could jeopardize public health, removing and replacing all 16 expert members of the task force for reasons that seem rooted in politics and culture wars. RFK Jr.'s stance on preventive health measures is perplexing, to say the least. He appears to view the prevention of curable diseases as too woke, a perspective that could have dire consequences for public health. The Preventive Services Task Force's role is to provide evidence-based screening recommendations that are updated regularly as new scientific studies emerge. Primary care physicians rely on these guidelines to determine the most impactful diagnostic tests for their patients, while insurance companies use them to decide which studies to cover. But here's where it gets controversial. RFK Jr. has already demonstrated his willingness to disrupt such institutions. In June, he dismissed all 17 members of the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, replacing them with vaccine skeptics. This move not only hindered scientific progress, but also eroded public trust in the organization, all at a time when measles cases in the US reached a 30-year high. And this is the part most people miss. RFK Jr. is reported intention to make similar changes within the Preventive Services Task Force is based on the notion that the members are too woke. The task force's recommendations, such as advocating for cervical cancer screening and the identification of postpartum depression in pregnant individuals, are grounded in sound medical advice. The use of inclusive language, like persons instead of women, is a minor detail that should not overshadow the importance of these recommendations. Even if RFK Jr. does not follow through with this purge, his actions are already sowing seeds of distrust in our medical and scientific institutions. Should he proceed, he will undermine the very foundation of public health that relies on preventative services, especially at a time when access to care for vulnerable populations is being threatened by Medicaid cuts in the Big Beautiful Bill. These actions will not lead to a healthier America. Instead, it will take us backward in our public health efforts and in the battle against cancer and disease. It's crucial that we raise awareness and take action against any measures that harm our fellow Americans. As a medical professional, I urge us to stand together and protect the integrity of our health systems. Let's not allow political agendas to jeopardize the well-being of our communities. Dr. Thomas K. Liu, an assistant clinical professor of medicine at the Stanford University School of Medicine and an attending physician of hospital medicine at Stanford Healthcare Tri-Valley, is deeply concerned about the potential impact of these actions on public health. His expressed opinions are his own, and he can be followed on X @ThomasLiu, MD.